Hi everyone, this is Allison Scott. I have 2 minutes to tell you about this, our first public health course offering in DC over spring break. I hope you'll join us. We really want to delve into this notion of health equity in this class. We can explore that in Williamsburg and discuss it till we're blue in the face, but going to DC is really going to give us the opportunity to explore that in a very real and visceral way. If you think about DC, if you've ridden the DC Metro, for example, or are aware of the Metro, you can think about it this way. If you get on the Metro out in Arlington, and you ride the Metro that relatively short distance to downtown DC, that's not a very long ride. You may not really think too much about what's going on around you as you're taking that ride. But if we look at the data, we know that babies born at the Arlington end of that Metro ride, on average, will live 8, even maybe 10 years longer than babies born at the other end of that Metro line. So the question that we're asking in this context, and then by generalizability to other contexts, is why is that happening? What is that about? It's not okay. It's not necessary. How do we understand it better, and how do we change it? So again, DC gives us the opportunity not just to think about these things theoretically, but to really look at them and experience them and to talk to people who are making a difference in this arena. So we want to talk to policymakers. We want to talk to federal agencies, whether it's places like the Office of Health Equity at HRSA or places at NIH. We want to talk to advocacy organizations, whether it's groups like Physicians for National Health Insurance, or Parks Prescription, or people advocating for smart growth or community gardening. We wanted to visit with grassroots organizations doing this work on the ground in DC. People, for example, providing health care to the uninsured, to immigrant populations, people working for the alleviation of poverty and workplace justice. All of these things that contribute to these notions of social determinants that are the ultimate drivers of health equity. So health policy is a piece of this, health reform is a piece of this, and we can't ignore that, especially in this country, because we got a big mess. But there's all this other stuff, all of these other factors that play into this issue of health equity. And being in DC will give us this wonderful opportunity to explore those with the people who work with those every day, and to see with our own eyes how some of those things work. We'll also have the opportunity to meet with a lot of alums who work in the area of health and health equity in the DC area and abroad, and those connections I think will be wonderful for you to make as well. So just let me know if you have any questions, and I hope to see you in DC. So take care.